and welcome to this Friday weekly webinar. Today to talk about physiological effects and therapeutic potential of yogic breathing, we have with us Dr. Om Lata Bhagat, who is Additional Professor, Department of Physiology, All India Institute of Medical Sciences, Jodhpur, Rajasthan. I heartily welcome you, ma'am. आपका बहुत बहुत स्वागत है इस कार्यक्रम में.
Thank you for inviting me, ma'am.
As per the tradition of our institute, let us start the program with prayer. Om Sahana Bhavatu Sahana Bhunaktu Sahaviryam Karvavahe Tejasvinavadhitamastu Ma Vidvishavahe. Om Shanti Shanti Shanti. As I told earlier that Dr. Om Lata Bhagat, ma'am, is additional professor in Department of Physiology, All India Institute of Medical Sciences, Jodhpur, Rajasthan. It is a matter of great pleasure that ma'am is with us to talk about the physiological effects and therapeutic potentials of yogic breathing. Our director of Muraji Desai National Institute of Yoga and Communication and Documentation Officer of MDNAY will join us shortly in this program. As far as introduction of ma'am is concerned, I am nobody to talk about the credential of ma'am, that ma'am has done so much research and teaching in physiology, and she has so much experience in clinical physiology and all. Dr. Om Lata Bhagat ma'am is a lifelong learner, student and researcher of physiology who has rendered preclinical, paraclinical and clinical services in various institutes and is well versed with the testing autonomic vascular and pulmonary functions. Her core research interest is in cardiovascular physiology, especially cardiac autonomic responses to the wellness practices like exercise, respiratory training, yoga, and meditation. She has more than 24 years of clinical and teaching experience in the field of physiology. She has acquired her higher education from Jawaharlal Nehru University, New Delhi, MGM Medical College, Devi Ahilya University, Indore, and other renowned institutes of India. She has more than 20 full research papers to her credit. She has delivered various invited lectures and talks at various platforms. She has been associated with more than 7 research projects as a principal investigator or as a co-investigator. She has been awarded with several awards like Dr. S. Radhakrishnan Memorial National Teachers Award 2015 for her contribution as medical teacher, and travel grants from International Physiology Committee and the Council of the American Physiological Society and various other bodies. She is member of several renowned societies like Association of Physiologists and Pharmacologists of India, Indian Public Health Association, Indian Association of with various innovations like a user-friendly heart monitoring system as a collaborative project of AIMS and IIT Jodhpur, with the purpose developing a low-cost long-term monitoring device for cardiac patients using a single patch. She has also developed a human voice-based instruction system for the respiratory modulation at targeted frequencies for pacing respiratory cycle to study the effect of respiratory frequency modulation on cardiac and vascular oscillation. It is a matter of great pleasure that ma'am is here with us to talk about potentials of yogic breathing. And without any further ado, I would like to invite ma'am to deliver the talk. Over to you, ma'am.
Thank you, Dr. Vandana, and I take this opportunity to thank the Director Sir of MDNY, Dr. Basava Reddy, for inviting me to the webinar. And Dr. Basava Reddy has has a very pivotal role in my career as a physiologist. Also, when I started my work in area of pranayama as a respiratory modulator, he's the one who has guided me a lot. So, thanks a lot for this opportunity. Let me share my screen with you, and so that I can start my talk. Hope you can see the screen.
Yes, ma'am. It is
Okay.
visible.
So, namaskar everyone once again. I am Dr. Omlata Bhagat, and I'm just trying to give you a glimpses of physiological effects and therapeutic potential of slow yogic breathing. The first thing I want to emphasize is that we all are going for, and the main thing which we want in our life is the health, and health is the most important uh, wealth which we can have. अगर हम स्वस्थ हैं तो जहान है. सो स्वयं में स्थित को स्वस्थ बोलते हैं, और ऐसा माना जाता है. सो अगर हम, और स्वयं में स्थित हम तभी हो सकते हैं जब हम योग का प्रयोग करें. So, WHO has got a definition of yoga as a state of a complete physical, mental, and social well-being, and not merely absence of disease or infirmity. Yoga Sutra Patanjali also gives a definition of a state of mind that is alert and in peace at the same time. We have got Kaya Sampath and Vyasbhas also giving the definition of health, which in terms gives a holistic approach as the WHO goes. So, our traditional knowledge defines health in a wider perspective. And yoga can be taken as a tool to achieve health, as the leaders like Swami Vivekananda and Sri Aurobindo has given us the insight into health. Like Swami Vivekananda has told that there is not a single muscle in the body over which man cannot establish perfect control by practice. Even the heart can be made to stop or to go on at his wish, bidding, and the same way each part of the organ can be made to obey him. And Aurobindo Maharshi has given us the definition, or that yoga is a methodological effort towards self-perfection by the development of potentialities latent in the individual. It is the process by which the limitations and imperfections can be washed away, resulting in a superhuman race. Therefore, we can take yoga as an exercise in a moral and mental cultivation that generates good health, that is arogya, contribute to longevity, that is chirayu, and the total intrinsic discipline cultivates into positive and perennial happiness and peace. Therefore, yoga is said to be the indispensable of the ultimate accomplishment in the life, that is health. And we know that the Ashtanga Yoga is the thing which we usually, when we talk of yoga, we talk of Ashtanga Yoga. And when we talk of health, we often talk of health as a social health. So, Yam Niyam caters to the social health. Asan pranayamas more caters towards our physical health. Mental health is being taken care with the help of pratyahara and dharana, and samadhi and dhyan are actually take us to a higher level of health, that is the spiritual health. And respiration is a part of almost each of these steps. And so, what is important? Why I'm taking too much time to come to my topic is that why the slow deep breathing is important and what is known as slow deep breathing. Even for a simple thing in our social life also, if someone is very uh, aggressive or something, or distressed, we usually say ठहर जाओ, लंबी गहरी सांस लो. So the slow deep breathing is very much into our all aspects of our health, and that is incorporated in all steps of Ashtanga Yoga. So what is slow deep breathing? Slow deep breathing is controlled breathing through low rate and high tidal volume. It virtually takes up the regulating and regulated variable points within the normal limits. It reduces sympathetic activity by enhancing the central inhibitory rhythm, thereby influencing the respiratory sinus arrhythmia and blood pressure oscillations. Slow deep breathing is known to improve the efficiency of ventilation by increasing the and alveolar ventilation and reducing the dead space ventilation as a result. So because of this, we can envisage that the possibility to integrate involuntary nervous system with a higher cortical mechanism through the voluntary control of breathing, because breathing is one thing which is involuntary, though it is involuntary, but we have a certain amount of voluntary control of it. So usually most often when we talk of slow deep breathing, usually people talk of the rate which is 6 breaths per minute. What is happening at the rate of 6 breaths per minute? Actually, the heart rate variability is the most, or in our system we have the oscillators which oscillates uh, at a particular frequency, and this is a place where all the oscillators like which is there in brain, so brain cells, our heart, blood vessels, respiration are in synchrony, and there is a phase delay between heart rate and blood pressure oscillations. Also, the muscle sympathetic nerve activity reduces. Slow deep breathing strengthens the cardiorespiratory coupling and evokes the short-term changes. At 6 breaths per minute, cardiovascular patterning, variability, and functions can be modulated by this breathing maneuvering, and it had shown to have a beneficial effect in reducing heart rate, mean arterial blood pressure, and usually it persists after the breathing exercise. It's not just by doing it is improving, the effect remains. So therefore it can be used for a therapy. So let us just look at how slow breathing has effect on heart rate. So we have done an experiment where we have taken 21 people and asked them to do a slow deep breathing at the 6 breath per minute and seen the recovery. So we have taken information at 4 time points: 5 minutes baseline, 5 minutes during the maneuver, 5 minute recovery one, and 5 minute recovery. So 10 minutes of total recovery. And we've seen that very few has got no change in the heart rate. Most of them have the increase in heart rate, and some of them have decrease in heart rate. But what is important is if we see that what is the initial heart rate and the recovery after 10 minutes recovery after 5 minutes of practice of breathing at the frequency of 6 breaths per minute, right? Is actually people are coming to a narrow range. Those who have a small, lesser or least heart rate try to improve, and those who have higher heart rate as trying to improve. In both cases, they are coming to the narrow range, not narrow physiological range. So it is actually, we cannot take it as yoga or the respiratory breathing, uh, yogic breathing, or any kind of slow breathing maneuver is not affecting that increase in heart rate or decrease in heart rate, but it is improving the heart rate, and it is taking it to the baseline level, or improve, or putting it to the narrow range of physiological importance. Similarly, slow deep breathing also improves the blood pressure, and this usually remains in the recovery also. So the perturbations done during the slow deep breathing helps in the reduction of blood pressure, and this perturbation and effect remain post cessation of the practice. So what is important is how the heart rate and blood pressure are affecting is usually we can take it as the autonomic tone is one which is directly affecting the heart rate as well as the blood pressure, and therefore we must understand the slow deep breathing is working or is affecting the whole body via the autonomic tone. That is what I suggest. So it has a so we can say that slow deep breathing has a therapeutic effect on autonomic tone and it induces the significant oscillations in sympathetic frequency range, and it may be mediated through direct mechanical coupling, autonomic modulation, or direct or dynamic interdependence. What do you understand by direct mechanical coupling? That when we take a slow and deep breathing, what we are doing is we are taking in a high tidal volume. Normally, we take this when we inspire, we usually take 500 ml, but when we inspire deeply, we easily go to the 750 or 900 ml, depending on how deep you are inspiring. So that increase volume, we all know that there is an interrelationship between volume and pressure. So therefore, when you increase the pressure, you actually increases the intrathoracic pressure, and this intrathoracic pressure causes the stimulation of ergoreflex as well as the baroreflex, which has its effect not just in autonomic terms but also to the molecular level. The second thing is our respiration and cardiovascular system are interrelated, and these oscillations are they are oscillating in synchrony with each other, right? Via the and this they communicate at the central level. It's not just heart and lung are residing in a same cavity, but also the higher centers are also lying side by side. Your respiratory controls and the vasomotor centers both are nearby to each other. So the autonomic, cardiovascular, and respiratory system appears to be interlocked. So if you change one, the other two will get changed. And we have only one capacity of controlling only one, that is respiration, right? And also this relationship is very much dynamic, and it has got a relationship which is it's not just one way, it is a two-way, and with each step or with each change, it changes. it has a synaptic interaction between the respiratory network and cardiovascular network. You have lungs, stretch receptors also works, intrathoracic pressure also works, and you have the vascular receptors. So not just these mechanical things, but your carotid chemoreceptor, aortic chemoreceptors, baroreceptors, the receptor at the level of smooth muscle, your arterial blood gas tensions, everything has a role to play when we talk of cardiorespiratory interdependence, right? So why I'm talking about this, because then I just want to tell you that what we are looking at is the heart rate variability. That means with each beat, usually we say that heart rate is uh, has a cyclical thing, and we have 72 beats per minute. But actually, each heart, each heart rate or each instantaneous heart rate is calculated by measuring the RR interval. And each RR interval, if we measure, has some difference. We will never have two RR interval, more than 5 RR interval of same sequence. You will have some change, and that is being assessed as a heart rate variability, which is a representative of or the marker of autonomic tone. So SDNN is the standard deviation of normal to normal RR interval, and which is a marker of overall variability. And RMSSD is the root mean square deviation of the differences. So, and this is a marker of parasympathetic tone. And you can see that both improves when you ask someone to just breathe slowly at the rate of 6 breaths per minute. So that means the slow deep breathing has effect on your heart rate variability. So in last few slides, I wanted to build the thing that respiration is important, and it has its effect on heart rate, blood pressure, heart rate variability, autonomic balance, and everything. And pranayama is a one yogic activity which is a very pertinent when we talk of respiratory modulation, because in pranayama we include the changes of various respiratory parameters like depth, rate, abdominal movement, resistance, ratio of expiration and inspiration, breath holding. So all these things are included in pranayama very beautifully. So pranayama can be used as a model of respiratory modulation of cardiovascular oscillations. There are various types of pranayama which we practice as a breathing practices. There are various types of pranayama which modulate either few or more respiratory parameters depending on the technique used. Like in Shitli and Shitkari pranayama, we increases the inspiratory resistance, and in Kapalbhati we increase the respiratory rate. In yogic breathing or a bellow breathing, we say we usually slow down our rate, and the focus is not on slowing the rate, but it is on increasing the depth. So likewise, we have different pranayamas and we change it. So it is hypothesized since a long that pranayama alters autonomic response to breathing pattern by increasing vagal tone and decreasing the sympathetic discharges. And when we record, you can see that the parameters as such, even when you start doing the practice of pranayama, your respiration comes, your depth and rate has changed, and this effect is reflecting in all the recordings: ECG, blood pressure, your FNIR system, which we are taking the from the brain, the blood oxyhemoglobin and the oxyhemoglobin levels of at the forehead. So you can see that all the parameters get affected, and these oscillations, which are barely physical or mechanical, we can say, get reflected in our uh, recordings also. And if we go into the details of these recordings, in this graph, the upper panel is for the resting level when the person is at rest, and the lower panel is when the person is doing the alternate nostril breathing or the Nareshodhan pranayama or Anulom Vilom. So you can see that the changes in the cycles in the RR interval and the cycles in the SBP are clearly aligned. Whereas when you do the pranayama or the slow yogic breathing, there it ensues the perturbations, and the relationship between the heart rate and the systolic blood pressure start changing. You can see that when we do the frequency power relationship mapping with the time, you can see that this is the time where during ANV or during Nadi Shodhan Pranayama, the frequency power is very much centralized to a particular frequency at which we are breathing. In this case of recording, we are taking recordings at the rate of 5 breaths per minute. And we can say that randomly we can have different breathing rates where you don't get any straight relationship. But if you give a paced breathing with the same rate of a conscious spontaneous breathing, you can see then the peak frequency changes. So pacing itself has effect. So if you consciously do a pranayama at a particular level, a particular rate and depth, it will have effect on your peak high frequency component, and the heart rate variability is at the max at the rate of 6 breath per minute or 1.1 hertz of frequency, right? And at this point, your autonomic balance, that is your LF and HF ratio, also is at the maximum. So my work is primarily on alternative nostril breathing, where we have seen the heart rate variability and seen the overall variability, that is SDNN, and parasympathetic tone, that is RMSSD. In novice volunteers who have no experience of yogic practices were included in the study, and we did experiments, and we can see that there is change in overall variability, but the amplitude, magnitude of change in the parasympathetic is not that higher, not that big. Whereas we can see that though it's not big, but the range started reducing. So that means even if mean doesn't change much, but the people are now coming towards a center or a narrow range. When people who are doing the Kriya Yoga, long term Kriya Yoga, less than 15 years of yoga practice, the during here we have not taken the recovery. So we have just two things, that pre ANB values and the during ANB values. And here we can see that the magnitude of change is way higher as compared to the novice. But if your practice is more than 15 years, here everyone has the practice of more than 15 years, and we can see that here the system becomes more resilient. Now, with this amount of perturbations, your system is not reacting too much. So your system becomes more resilient. So yogic breathing has made your overall system a resilient system. Now you can better react to the stresses you are getting in day-to-day life. Because even a single thing like uh, a bad news can make change in your heart rate, respiration, blood pressure, and everything. If you make your system resilient, you can actually take these things in a better way. The other pranayama also we have discussed and studied. Dr. K.K. Deepak at AIMS Delhi. I am in association with him. Under his guidance, we did this study and we found that the heart rate variability improves with almost all the pranayamas. We did, this is A and B is alternate nostril breathing, that is your Anulom Vilom. Then you have right nostril breathing, Chandranadi, and left nostril breathing, Suryanadi, Ulta carrying. Right nostril is Suryanadi and left nostril is Chandranadi. So, and then inspiratory resistance breathing and expiratory resistance breathing. So, Shitli Pranayam and the Bhramari and normal breathing. So, overall variability improves in all. Parasympathetic improves if you increase the inspiratory resistance, and heart rate and respiratory arrhythmia is changes in both, in almost all. Then, so this is what I want to. Now it's not just heart which is affected by slow deep breathing or slow yogic breathing. It also affects the uh, respiratory entrainments of the this slow rhythms entrains your cerebral cortex, and your slow receptors and rapid adapting receptor and slowly adapting receptors both has the effect, and therefore it improves your heart rate variability over the time. It's not just a heart rate variability or autonomic thing. It actually causes the some of the inhibitory signaling via the GABA receptors, and it has its effect on very thalamus. And we all know that thalamus and hypothalamus are the area where which is all the emotional things, all the feelings, all the sensory pathway has a center there. So you have, so it affects your it inhibits your strong emotions also. So thereby you can actually improve your stress resilience. It has its effects on not just heart, or lungs. It has effects on your GIT, your brain, your almost all parts of your body. And this is, if you make yourself more and more entrained to the slow breathing or yogic breathing, which leads to the meditative state, which actually gives you not just change in heart rate or change in blood pressure, it actually gives you a more relaxation. With improving your relaxation, it improves your attention and focus, also improves your memory. Therefore, we can say that in healthy individuals, these are all studies which are done in healthy individuals. So we can say that the short-term changes expressed by healthy individual reflects a potential for repeated slow deep breathing or slow and deep yogic breathing exercises, invoking a long-term changes in cardiovascular control. Uh, how slow deep breathing decreases the blood pressure? It actually increases the tidal volume. When it increases the tidal volume, it activates the pulmonary mechanoreceptors, which in turn activate the cardiac mechanoreceptors. And these then causes the inhibition of sympathetic outflow to the skeletal muscle blood vessels. And therefore, there is a widespread vasodilatation, which leads to decreased peripheral resistance. And decreased peripheral resistance which help in the lowering of blood pressure. There are studies which says that when slow deep breathing is practiced twice daily at home over about 3 months period, baroreflex sensitivity is increased and it can help hypertensive patients to lower their blood pressure. There is a device which came called as Respirate. It is taken as a non-invasive option for treating hypertension, and this device is actually helping people to breathe slowly and deeply. As we can give instructions in pranayama. So pranayama practice in this device mimics the pranayama practice. What if we increase the resistive load to the breathing, that is inspiratory load? It says the change in blood pressure is more. So it improves better if you increase the resistance. So that means if you, and there are so many pranayams in which we actually increase the inspiratory resistance or the expiratory resistance. So an inspiratory load of 20 centimeters of water enhances the decrease in systolic blood pressure in participants trained for 30 minutes twice daily for 8 weeks. And an unpublished data from AIMS Delhi study that inspiratory resistive breathing causes decrease in systolic blood pressure, whereas expiratory resistive breathing increases. So therefore, we can have both the things. It can help in maintaining your normal blood pressure. Not just blood pressure, it helps in your pain perception. Slow deep breathing increases the pain threshold and tolerance. It reduces the negative affect rating following the thermal pain. And yogic breathing is essential. Slow deep breathing is an essential component in the modulation of pain perception in concert with the relaxation. And how does it does? This is a study which we conducted in AIMS Jodhpur. It shows that though the threshold doesn't change much, but a person is now able to tolerate pain for a longer duration. So you can see that the person previously the same this is the same people. So in repeated measures t-test, we found that person can now can tolerate pain for a longer time, almost more than 30 seconds. And how it does affect? So there are few things people have said. The slow deep breathing modulate pace perception indirectly throughout the cardiovascular autonomic changes or changes in vagal activity not associated with magnitude of pain modulation. People says Martin et al. Has given that the respiratory induced pain modulation may involve strictly the supraspinal structure. That means it is more not the reflex thing. It is more about the autonomic control and the perception level. Jaffrey et al. Has said that the slow breathing modulate afferent nociceptors at the spinal level. So people have given different theories depending on their experiments that slow deep breathing affects at the spinal level, at the supraspinal level, at the cardiovascular and autonomic changes, and but it's not just vagal which is affecting the whole thing, but many other things are getting affected by slow deep breathing. Therefore, and relaxation and distraction may contribute to respiratory hyperexia. Chilai et al. And Bush, these two group has said that it's not respiratory modulation or yogic breathing is not affecting. Actually, slow deep breathing is causing relaxation and distraction from the pain. Therefore, it is causing the respiratory hypoacusia. Apart from this, people going to high altitude get affected or get influenced or get benefit from slow deep breathing. Orthostatic challenges like people who have problem of syncope, so they improve with the continuous practice of slow deep breathing and mean arterial pressure and mean carotid artery vascular velocity is also changed. So there are over the age, over the period, or as they age, this decline is slower. So the orthostatic, the people who do slow deep breathing has better tolerate the orthostatic challenges. With age, we have often seen that people do have a syncopal attacks, that they suddenly fall on standing for long or suddenly standing from lying down. Motion sickness also improves because slow yogic breathing prevents the development of gastric arrhythmias and decreases the symptoms of motion sickness. Even type 1 diabetes mellitus, people have seen that the slow breathing practices has restored the blunted baroreceptor sensitivity irrespective of disease duration. And also in these patients, it is likely to get the hypertension as they grow older. But with the practice of slow yogic breathing, we might delay the development of hypertension in these patients. In asthma, in asthma also, it is shown that the increased dose of histamine is needed to provoke 20% reduction in FEV1 using Pink City lung exerciser, a device which imposes the slowing of breathing and a 1:2 uh, expiration and inspiration ratio. So this device is also developed by a person from India, and this is a device which mimic the slow deep breathing, and he has taken up the concept of 1:2 of yogic breathing, ratio of 1:2 of inspiration and expiration. So these are some glimpses which I try to put and shown you things. So, like, I just want to conclude with the remark that slow and deep yogic breathing has immense therapeutic potential in a wide range of conditions, ranging from day-to-day challenges to non-communicable diseases. And we all know that lifestyle diseases definitely going to get affected. In initial phases, they can be used as monotherapy, or in a patients in a severe condition or moderate to mild to moderate conditions, they can be used as the adjuvant to the regular, because they don't have any side effect. So they definitely are not going to interact with your regular medicine. And the more important point to be noted, that though we know that slow deep breathing and or the yogic breathing has so much potential to be used as therapeutic help, also has a tremendous physiological influences on overall body, and it is not changing things to beyond the physiological range. It is giving a perturbations within physiological range and making our system more resilient. So we need to study them well, and we can actually take this as a potential area for translation research in field of yoga, as well as in field of physiology and clinical sciences also. With this, I conclude, and I want to thank the organizers and my team and my mentors for where I am. So whatever I know or whatever I have here is because of everyone which came into my life. So thank you very much, Dr. Vandana, and thank you to all the organizers and directors from bottom of my heart. Thank you.
Thank you so much, ma'am, for delivering such an elaborative and informative lecture to our viewers. There are few questions in the comment section. If you would like, I would like to ask them.
Sure, sure.
Ma'am, somebody has asked about uh, the human voice-based instruction system for the respiratory modulation that you have developed. Uh,
Actually, we developed it for our study, and in that, what we have used is the uh, like breathe in. Usually, when we ask, there is a beep tone is there. So you have to inspire till a particular sound, and then this sound stops. So that usually is some people may take as a noise. So it directly affects you. That time we recorded the breathe in and breathe out records, and when I personally gives it the instruction, the cycle is not exactly the same. So therefore, we developed a system where we have actually used the sound and developed a loop kind of system, loop kind of recording for which can be for different heart, different respiratory rates. But we could not take this device to the market level because I had to shift from AIMS Delhi to AIMS Jodhpur, and that time because of some personal reasons I could not take that project to the next level. So I'm sorry for that. But now I am doing, when I'm doing my PhD, now I'm enrolled to a PhD with medical technologies. That's a combined program of IIT Jodhpur and AIMS Jodhpur. Here we are trying to develop a device not just to give the instruction, but to give instruction in a way where the person can be relaxed depending on whatever the baseline of the person. We will be record that person will have sorry, the device will have some kind of say, baseline recordings, and that record depending on what, so we will have some algorithms that how, so maybe we can help them improving their overall health. So I don't know with how far we can go, but we, because from that idea only we are actually reaching to this point. It is very nascent now, in a very preliminary or very elementary things. So we are trying to improvise. I'm sorry for dropping that project in between, but we have developed that way. If someone wants to get that, I am more than happy to help them, because in that we use the audio editing softwares also. We have taken the help of engineers also to put that thing. So we majorly a sound engineer had helped us in that. Thank you. Hope I hope the person got the
Yes.
right.
We can wish you luck. All the best for your next project, ma'am. Maybe see that device and in the future soon. And I would like to thank you for delivering such an informative lecture from the bottom of my heart. आपका बहुत बहुत धन्यवाद हमारे सभी दर्शकों को इतना सुंदर व्याख्यान देने के लिए। मुरारजी देसाई राष्ट्रीय योग संस्थान की तरफ से तथा स्वयं अपनी ओर से मैं आपका हार्दिक धन्यवाद देती हूँ, तथा हमारे संस्थान के निदेशक महोदय, हमारे संचार एवं प्रलेखन अधिकारी तथा हमारी तकनीकी टीम का भी हार्दिक धन्यवाद, और हमारे सभी दर्शकों का भी हार्दिक धन्यवाद जो हमारे बीच आज इस कार्यक्रम में उपस्थित हैं। और हमारे संस्थान की परंपरा के अनुसार कार्यक्रम का समापन शांति पाठ के साथ करेंगे। सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्, मा कश्चित् शान्तिः शान्तिः। Thank you so much, ma'am. Thank you once again.
Thank you.